These are my best. Okay. Today, I'm breaking down the 2 most common reasons people leave medicine. These are my best hypotheses, spliced together through reading Reddit, analyzing subreddits, watching YouTube videos of doctors who recently left medicine, and also thinking about my years of interactions with colleagues. At the end of the video, I'll also share the reason why I left medicine, a reason that I haven't seen discussed anywhere else, and the reason at the root of the doctors quitting medicine problem. Let's get to the reasons why people leave medicine. Reason number 1, burnout, aka lack of fulfillment. When I was burned out, it went like this. I'd see a patient who had endured something horrible, was in a lot of pain, or had experienced some pain in the past, and I couldn't feel empathy anymore. It wasn't that I didn't want to feel what they were going through or that I didn't want to help them. It was just that I couldn't. My reservoir for caring was empty. I felt nothing. This is a common experience in medicine. The sad part is that the experience doesn't stop when you leave the hospital. Burnout and that feeling of not being able to feel anything anymore, that happens outside. It happens in relationships too. It happens in your whole life. And this is bad if you're a human being because empathy is our lifeline. Without empathy, there's not much life. In a minute, we'll get into some of the causes of burnout inside of healthcare. But let's say you work in a coffee shop or you work in an office setting. You have a really tough week, you deal with a bunch of tough clients, or you have a bunch of deadlines you've got to hit, it's a stressful month or two. Then you have a period of inactivity. You have a weekend to catch your breath. As a physician, you don't get that. The work hits different. When you show back up to work, the people you're seeing are often having the worst days of their life. And it's your job to fix that. That drains your tank really fast. And if your tank is already low because you're really burned out, it becomes impossible to ever get your tank back up to a place where you can sustainably do your job and enjoy it, unless you change something. At this crossroads, a lot of people leave the profession, apparently. What I saw happen more, and something that I tried in my own experience in medicine, was to start working less. Enter locum tenens. Enter somebody going from corporate medicine back into academia. Enter someone taking on a 20-hour commitment instead of a 40-hour commitment. For a lot of people, this works really well. I have seen some people change specialties even and experience massive quality of life increases. And I've seen some people just start to work less or go work for a different company and experience a much better environment. And I do think that that helps. But I've also seen some people not figure it out and stay burned out. Those people end up becoming the jaded physician. Next reason, or shall we say sub-reason. Reason 1A, insurance, EMRs, charting. There's just too much time at the computer. There's way too much time for physicians at the computer. All of that time contributes to burnout because people don't go into medical school to type. At least I didn't go into medical school to type. I went into medical school to please my parents. I did not go into medical school to type. Different story for a different video. Of any single day that I worked in medicine, even if it was a lighter day, an 8-hour clinic day, or if it was a 16, 17, 18-hour day in the hospital, at least half of that day was always spent typing notes. That's a lot of time sitting. This is not why people go into medicine. This is a reason why people go do something else besides medicine though. And this reason is often cited as a reason why people are getting out of medicine. Okay, next reason. Reason number 1B, bureaucracy. Again, this is a sub reason below burnout because I do believe this contributes to burnout. Doctors don't go to business school. Doctors don't go to management school. Things start to get hairy when you ask a group of doctors to self-govern itself. When you add in hospital administrators that incentivize those leaders on productivity, example RVUs, that is a recipe for decreased enjoyment across an entire workforce. Not all the time, I must say. There are some wonderful clinics to work for, some amazing business structures and hospitals. There's great medical schools, there's great residency programs. There's a lot of really good places to work. This doesn't happen everywhere. I'm just saying that a lot of people report bureaucracy as a primary reason why they decide to leave medicine. I find this a strange reason to leave medicine though, because if you are to go and work anywhere that has a group of people together working, you're going to encounter bureaucracy. So I think it's like a wherever you go, there you are type of situation, but regardless, this is one thing that people say contributes to them leaving medicine. Next reason, this one is separate. Reason number 2, equal pay, less work. Occasionally, a physician will have a side interest that grows with them on their path through medical school, residency, and attending physician life. Eventually, this side interest can take on a whole new life of its own. For a strategic few, they can parlay this growing side interest with their medical expertise into a non-clinical job outside of medicine, where they're not working 80 hours a week on patients whose lives depend on them. Enter biotech jobs, enter AI healthcare startups, enter management consulting firms, enter big pharma. This is the exact solution that I hoped would save me while I was floundering and burned out at the end of residency. But I did not have a side interest that I could just hop on to train track and take me off and out of burnout. It's working out regardless. We'll see. If you read Reddit enough, this strategy appears to be something that people have actually accomplished. I don't know anybody that's done this, but it appears possible. And people say that it is a lot better than the life they had while they were in medicine. So you can take that for what it's worth. Let's get to the next reason and the last reason. Reason number 3. A lot of doctors never wanted to be doctors. I wish there were a screening test with a mandatory truth serum that every medical student had to take before they started medical school. It would go like this. If you say yes to any of the following questions, go home. Do not go to medical school. Question number 1, are you here because you don't have anything else left to achieve? If your answer is yes, go home. Are you here because your parents want you to be here? If you answer yes, go home. I would have said yes to both of these questions. I never wanted to be a doctor. At that point, 10 years ago, it was daunting for me to say I needed to go figure out what I really wanted to do with my life instead of going to medical school. I was scared. I didn't do it. It took me 10 years to do it. And the fact that I never wanted to be a doctor put me at the most risk for being burned out later in my career. And it's the reason I left medicine. And I suspect it's the underlying reason most people leave medicine, because they never really wanted to be there in the first place. Let's say you do well on your first standardized test whenever you're in kindergarten or first grade, or whenever they start standardized testing kids these days. Parents get the score back, says they scored in the 99th percentile. Everybody's so proud of their kid. Kid continues to make A's all the way through school. Kid wins a bunch of awards through grade school, then makes honor roll in high school, starts doing all these extracurricular activities, gets into some really nice college, does a really good job while they're in college, gets a 4.0 grade point. What's the natural destination of that outcome? Medical school. It's assumed that once you get into medical school, everything will work out. This is a lie. Medical school is hard. For medical school to work, you have to want it in your soul. That's not even speaking about residency or attending. It does not work out for everyone. I'm telling you this because whenever I look around at the people I worked with, medical students, co-residents, attending physicians, there weren't that many of them who really enjoyed what they did. I would throw the majority of burned out physicians into the category of them never wanting to go to medical school. Really? Yeah. I'm not a mind reader, so I could be wrong. When you look around at the people you work with, in any career, you can always tell the people who really want to be there. The people I worked with that suffered the least amount of burnout and the ones that recovered the fastest from the darker days were the people that loved it. I've said this before, and I'll say it again. Medicine has a lot of problems, but I have plenty of friends who really enjoy their jobs in dermatology and ENT and urology and plastics and gen surg, and OBGYN, and psychiatry. The common denominator in these success stories is passion. You gotta love it. Moral of the story, if you really love it, if you really love the idea of treating people and helping folks and figuring out answers to really hard problems, go be a doctor. You can be happy doing this job. The suffering that's inevitable, the sacrifices that you will endure will be worth it if you care. If you don't, or if you never did, it's worth finding out what you do love. Everyone deserves a chance to wake up excited to go to work, and it just may not be medicine for you.